Welcome to Healthy Living. I'm Dr. Debbie Lyons, and I have to tell you, we have a wonderful show for you today. We're here at the emergency department of Hilton Head Hospital, and you know, sometimes it's fun to know that real people go here. About a month or two ago, I had the opportunity to visit the hospital. I wasn't feeling really well, and it was the most phenomenal experience, and we felt like it would really be a wonderful thing to share with our viewers exactly what to expect. When I arrived with my husband here at the emergency department at night, and I recognized that because of COVID, safety is key. And so one visitor, he was with me throughout the whole process, which was amazing. It's funny, put my mask on, which I keep in my car now, I think we all do, and I walked in. I have to tell you, I was feeling a little bit apprehensive about what to expect, but I should have known that here at the hospital, everything and my experience would be facilitated by someone. My first stop here actually was with Mr. David. Good to see you again.
How you doing?
Good. And I call him the director of first impressions. It's amazing. My husband came without a mask. They have masks. He basically was here just to make sure everything was okay. I was safe, husband was safe. He got us initially sort of checked in and talked to us a little bit about why we were here.
Right.
And then you moved us right along.
Right to registration.
Right to registration.
Yeah.
Let's go ahead. Thank you so much. So again, we came in, Mike sat down, and I moved on to registration. It's interesting because I think with COVID or without COVID, it's really nice to know that there's some spacing between each of the clients for a couple things, for privacy and for safety again. When I came up, I wish that I had had this information. And the information is, hello, and what do you need from me? As a patient coming in.
Name and date of birth.
Name and date of birth, first thing. I recommend also you have a list of your medicines and you know kind of what's going on, because again, this is going to be the first person that you're going to see, and they can make or break an experience. And because I had the experience with you all, you were phenomenal. I mean, you really were. What we're going to do now is we're going to actually take a break, and we're going to come back, and we're going to tour through the emergency department so you can actually feel what it would be like to experience the going here if you are a patient. So stay with us. Okay, Brittany, I have checked in.
Okay.
And now, what is my next procedure when I come to the emergency department? What can I expect? Where am I right now?
So right now you're in our triage chair. We bring everyone back here. We do their vital signs, ask them why they came to the ER, what made them come specifically right now. You may have multiple symptoms, but we try to focus on what you're primarily here for.
Are most people, when they come in, just scared to death?
Some not so much.
Not so, okay,
Yeah.
okay.
Yeah.
So my husband who comes with a hook through his hand from fishing, not so much.
Yeah, no, he might be pretty upset. You know, it depends on the pain level, you know.
Me
if
with
it's
chest
bleeding.
pain. Me with chest pains.
Yeah, usually the people who have chest pain or they don't understand what's going on are the ones that are a little bit more nervous, more scared. So you have to help calm them, reassure them that we're going to take care of them.
What does triage actually mean?
So, I believe it's a French word actually, but
But what are the goals
so
when
what
I'm
we
being
do
triaged?
is it's a score to help us determine who we need to bring back the quickest, who we need to treat in a prioritization manner.
Okay. And what would that look like typically?
So for us, our cardiac arrests, our heart attacks, our unresponsive patients.
Okay, so something that looks life-threatening.
So yeah, anything very life-threatening is our number one priority. So those are the ones we're gonna treat first, make our priority. Second would be like our strokes, potential heart attacks, chest pains, stuff like that. Potential life-threatening.
You know, it's interesting.
It depends on the stability as well.
Oh,
Vital
that makes
signs.
sense.
Yeah.
Do you assess my pain level too?
With every patient, we do.
Okay.
Initially, we get a pain level score, depending on if they can talk or not, or their facial expressions. It may vary in how we score them, but we do. And then if we do treat them for pain, we have to go back, rescore them based on if we give them medication or not.
You know, when we walked in, as you were taking me here to triage, I also noticed a room with chairs and some other chairs that looked pretty comfortable.
Right. So these are recliners. They're similar to the ones that you're sitting in now. It's kind of what we call our fast track room. They're people that we potentially can bring back. If we're super busy, we bring them back, get labs started, EKGs, stuff like that, to get them in the process until a room may open up.
Okay.
Otherwise, it's people who can be seen by the doctor quickly, and we can get them out of here. You aren't going to get a nice, comfortable bed, but you get in and out quicker. So that's the goal of that room.
That's so brilliant.
Yeah.
Where are we going to go next?
So we can go take a look at that room if you would like to.
I'd love to.
So here we would do your vital signs, get your allergies, maybe a quick med list, just so I know if you're on a blood thinner, if you're having chest pain, if you take aspirin, you know, meds that might affect why you're here.
So having a med list is really important for me to bring. What other things do you like for me to bring?
So med lists
look at this. Yep.
The medication lists are important just so it helps us determine what may affect your health.
Okay.
I would say that's important for every patient to have a med list at some point in their life, just because if an accident were to happen or if an emergency were to happen, you weren't able to relay those medications, at least you have something written down.
Let me ask you about people coming with you to the emergency department. What do you recommend? Do you recommend that someone come with you to kind of act as an advocate? And I did notice as I walked in, because of COVID, I think it's basically one visitor per person.
During COVID, we were limiting visitation just because of
safety,
the severity of it. Yes, for sure. Now we don't have those. We do not have a visitation policy in effect right now.
Okay.
So we do try to limit the number of people that come in and out, just because if we're super busy, it kind of just you know, there's just a lot of people, a lot of things going on. Yes. So, but we are not limiting visitors right now.
Okay.
Depending on what your diagnosis is it beneficial to have someone with you? Of course, we'll let them back, you know. If it interferes with your care, then maybe not. It just depends on.
Typically, if I'm in a room or I'm in a bed and you need more information, is that when registration or someone will probably come to me to get more of the information that we need?
Yes, I mean, if you have it, if you have insurance, if you don't, that doesn't necessarily, that has nothing to do with whether we take care of you. That's a whole separate department from nursing or, you know, the ER, but
getting quality care.
Right. So they may come in and ask you for, you know, for your insurance information if you have it. If not, you don't have it.
You just don't have it, and that's
keep
just
going.
the way it is.
Yep.
You don't feel good.
And if you don't have the money to pay right then that doesn't affect it either.
It was fun because we were talking to Matt, one of the other nurses, and Brittany, and talking to you. Tiffany, I'm sorry.
That's okay.
I'm like, oh my gosh, that's my niece.
No problem.
We're also talking about the caliber and quality of staff that you have. You've got great professionals here too. Nurses, physicians.
Thank you. Yeah, all of our doctors are board certified ER doctors, so they're very good. They have a lot of experience from different areas of the country. They come from different places. Several doctors have been here for a while. Some are a little bit newer. Some are younger. You know, they provide a different take on how they treat patients.
Well, this will be a fun question.
Okay.
Is there a method to the madness of how rooms are laid out? In other words, well, that's the real question.
The majority of our rooms here in the ER are they're private rooms.
Okay.
So that's good in a sense. You have your own privacy. This room, of course, is not private, but it can be separated by curtains.
We're being expedited for this one.